Um, all right. Well, welcome everybody. Kelly, I'll turn it over to you for some introductions.
Yeah, good morning, everybody. Welcome to our Coffee with the Coalition. We are really excited that you're here. This time we have Sherry from Peaceful Hearts Hospice here to talk to us about their holistic program. And I got to meet Sherry and her team a couple of weeks ago, and they are doing some real innovative culture change type things in their program and their business for their end-of-life patients. And so I really wanted them to come and share because I think we learn best from each other, and everybody can take away a little bit of something from every one of these. So Sherry, I'm going to let you go ahead and take it away.
All right. Well, thank you very much. Thanks for having me. Karen was going to join us today, but she wasn't feeling well, so it'll just be me this morning. So just a little bit about myself. I am a nurse. I'm also a certified healing touch practitioner, and I oversee the holistic department at our hospice company, Peaceful Hearts Hospice. We're located in Elkhorn, Nebraska, is where our office is, but we travel 60 miles in any direction from our office except into Iowa. So please ask me any questions throughout this entire presentation. Don't hesitate to just speak up and ask me anything you need to ask. So I'm going to be talking about integrating holistic modalities to improve end-of-life care. And I'll go through some of our top modalities that we use, and then also touch briefly on some of the other ones we also offer. So we are a newer company. We started a little over 3 years ago. The first year we focused on licensure and passing accreditation, and we've been seeing clients for a little over 2 years. We offer over 25 different holistic modalities as complementary services to our hospice clients. We never charge them for any of these services that we offer. We provide these services because we have witnessed how much it really helps with symptom management and quality of life when people are at end of life, instead of using as many comfort medications such as lorazepam and morphine, for example. When we utilize some of these other modalities, we're able to use less medication for our clients. So we integrate our holistic services into our plan of care. So our holistic services are used to address symptoms and comfort, and we also assess effectiveness. Everything we do is for a reason, to help the client feel better and to have a better quality of life. So the holistic philosophy we follow includes the whole body, the physical body, mental body, emotional body, and spiritual body. So the word holistic comes from the Greek word holos, which means entire or all. So it is very important, we know, to care for the entire body of a person. We have seen many hospice clients who are experiencing pain, and the cause of pain actually could be emotional and actually not physical. And so these holistic services has helped us to address our clients' needs and help them be more comfortable at end of life. One of the top modalities we use is called healing touch. Has anyone ever heard of this, of healing touch? No? Okay. Well, it's a type of energy work. It was created in the 1980s by a nurse named Janet Minkin. It's a form of energy therapy. So we all have energy running through our bodies, such as like if you get an EKG, you can see that the energy of your heart is showing on that EKG. And what happens is that the energy can get blocked in your body, and that can cause anxiety, pain, different types of symptoms. And so healing touch uses different gentle techniques that's either on body or even off the body, can work off the bodies if someone doesn't like to be touched. And it helps just break up those blockages and help the energy flow freely, and it can really help someone feel much, much better. It helps clear the energy, energize them, and when a person's body is balanced, they can really heal and feel as best as they can. heal to the best of their ability and feel much better. We also offer music therapy, and our music therapist uses different techniques to calm or energize our clients. She uses different instruments and engages the clients in the sessions. One principle she uses often is called the ISO principle, in which she uses music to match the current mood of a client. Say, for instance, someone is very agitated or anxious, she'll play more upbeat music and then gradually slow that music down to a more calm state, and that helps the client calm down and be more peaceful. The opposite is also true. If someone is very lethargic, she can start with calm music and then gradually play more upbeat music, and then that person will usually, we have seen, they will wake up, they will be more upbeat, they will be more energized, they will be able to eat and just feel better. We've also seen a lot of benefit with music therapy with clients with dementia. People who are nonverbal can actually remember songs that they knew in their younger years and sing along. We even had one client not too long ago that she was nonverbal, but after her healing or her music therapy session, she would actually be able to speak in full sentences for a few minutes. And that was very, very important to her family. And that was just wonderful to see. We also have a musician who plays the clarinet, and he will make visits as well to bring joy and calmness and peace to our clients. And they really enjoy him also. Massage therapy is also a modality that is used very often. We offer many different types of massage. It just benefits so many different ways with pain, relaxation, and even with edema. A lot of people at end of life will have a lot of swelling throughout their body, and massage can really make a difference in decreasing that edema and helping them be more comfortable. We actually had a 101-year-old man who before our service, before he went on our services, he was very, having a lot of pain in his knees. He had tried cortisone shots and some different things like that and was just not having the results he wanted. And I sent our massage therapist to see him, and he was pain-free. He was so excited. So, you know, instead of giving him a lot of medication to help try to mask that pain that he was having, we sent our massage therapist twice a week to see him. And he is just so happy to see her, and it's improved his quality of life immensely.
Sherry, can I ask a question? This is Kelly.
Yes.
Is there any, sorry, I would turn my camera on, but I can't get it to work. Is there any like patient or diagnosis that massage therapy would be contraindicated in, or does it work like for everybody? I mean, if someone has like, I'm trying to think, like lymph node issues or like a lot of nerve pain, does it still work for those people that are very sensitive to touch? Or
Well, we really like plan what we want to do based on the client's symptoms. So I should also add that our massage therapists also do different types of energy work. And so we have had people in the past where they really benefited from massage, but then as time went on, touch was very uncomfortable for them. And so our massage therapist was able to switch to a different type of energy work like healing touch or Reiki or craniosacral therapy. And so the client was still able to get that benefit. We just had to, well, it's individualized care is what it is. We really just want to do what's best for the client, and we always look at their symptoms and what will help them the best. We can't do massage if someone has open wounds. You know, they can still visit the person and massage maybe their neck or shoulders, and then they'll just avoid the areas where there are wounds. Does that answer your question?
it does, thank you.
Oh, you're welcome. So the next modality that I want to talk about is emotion code body code. And this is a modality that a lot of people have never heard of. This was developed by Dr. Bradley Nelson. He's a holistic practitioner. And it's actually an app that you can purchase on your phone. Our practitioner has went through different certifications, and it is a series of tables that she uses muscle testing. So for instance, if someone was having a lot of anxiety, she would ask for the underlying or root cause of that anxiety and then drill down through those tables. She would say if it's on the right side or left side of the table, and then go on down until she found the underlying cause. And we have seen remarkable results from this, especially veterans at end of life. They can become very, have a lot of agitation or anxiety, just restlessness, based on, you know, previous experiences they had in their life with their service. And we saw someone who was in Korea, and he was a friend of mine's father, and he just was so restless and reaching out, and we could not figure out what could possibly be causing this or what was bothering him. And we had a session of emotion code, body code done, and it cleared everything that was trapped, like trapped emotions, trapped. There's so many different things that can be trapped. Emotions, feelings, like in your liver, there can be trapped emotions such as anger. Your lungs hold emotions such as grief. Just different parts of your body can have different emotions trapped in them. And she was able to clear those, and the person, our client, settled down. He was very peaceful for the rest of his time that he was here, and his family was so very grateful. We also had a woman who was very fearful with water. She did not like to shower. She would yell and scream. She had had a near drowning experience earlier in her life. She also was in a fire earlier in her life. And so every night she was having these dreams and yelling and screaming, and was very upset because she thought she was in a fire. She was reliving that. And so we had a session of emotion code, body code done for her as well. And that cleared everything from her body, everything that she had experienced. And she was very peaceful. All the reliving of that fire every night, she was not doing that anymore. And she was just very cooperative with her showers and her personal cares. And it made a huge difference in her life and her quality of life. Her family was happy, and the staff as well was amazed by the results that we received from doing that modality. Do you have any questions about that? I know that is kind of a different concept.
Sure, you said there was an app. Would you, is that something like anybody can purchase and access? Or?
Well, anyone can. It's very expensive, and then there's the certification that goes with it. So I know it's thousands of dollars. I'm not
got
sure
you. So
it
it's
is
not
right
like
now.
just a app you use on your phone. It's something that your provider would go through with people, is what you're saying.
Yes, I mean, you can't, yes, and you would download it on your phone. But then there is that extra, let me back up. So years ago, you could just buy the app, and they have changed things since then. And now it's become like a monthly membership, I believe, last I knew. And then there's more certifications that go along with it.
Got you. But your services are available to the public, correct? Not just your hospice patients?
Well, yes, we do have a foundation as well. It's called Peaceful Hearts Holistic Foundation, and it's a nonprofit. And we use that to do some fundraising to help cover the expense of these complimentary services that we offer to our clients. And in addition, we can also provide these services to the community. We do have a treatment room in our office where people can come in and have energy sessions or massage sessions. And we also can make appointments to have people have the emotion code, body code sessions, or any of these sessions, really.
Thank you.
You're welcome. We also have a certified clinical aromatherapist. She uses different essential oils to help people with pain, anxiety, and she also has made shampoo before to help people with scalp infections. Again, The goal of this is to help symptom management and to help people have the best quality of life as they possibly can. Craniosacral therapy is another form of energy therapy with it's a gentle touch. It helps people, again, with pain and anxiety, which really pain and anxiety are two of the most seen symptoms we see in people at end of life. And so we really focus on those a lot. This modality helps regulate the central nervous system. So we did have a lady with lung disease, and she was having a lot of difficulty breathing, especially as she got more toward end of life. And our practitioner was able to go and do some craniosacral therapy for her. And it would really just calm her nervous system down, and it helped her anxiety, and it helped her breathe easier, and it just really made a difference in her life. So then I'll just briefly touch on some additional holistic modalities that we offer. Access bars is another type of energy technique, which deals mostly with touching the top of the head. There are 32 different points on a person's head, and this again promotes mental clarity, relaxation, helps with anxiety, depression. We have an acupuncturist. Now, this modality is not used very often. Usually we see people request this if they have had an experience with acupuncture earlier in their life, if it's something that they enjoyed doing before. Are you familiar with acupuncture? It deals with needles.
Yeah, for sure.
Little needles are put in the meridian lines on a person's body, and it helps again to restore energy balance. We have an art therapist who also can see our clients, and that helps with processing emotions and expressing feelings. We had a gentleman who was having a lot of anger and anxiety, and art therapy really helped him to process those emotions. And then Bach flower remedies. We haven't used this too often, but we have had some success. There are 32 different remedies. They helped with emotions and feelings. So there's a questionnaire that we can fill out. And each remedy is based on how a person is feeling and who the person is. And so that's something, there are drops that you can put under your tongue, and it can just really help a person with anxiety and pain and just overall well-being. Body memory recall is a gentle hands-on technique that helps transform body memories and help a person experience healing. We have a chiropractor that also works with us. He doesn't see a lot of patients because some of our patients are very fragile, but we definitely have seen a lot of success when he has been able to make a visit and help with alignment issues, and can really help people with pain and just overall feeling better. We have a clinical herbalist who can also make up different tinctures for our clients. We've had a lot of success with people who have had persistent diarrhea, even when medications have not been able to stop the diarrhea. The herbalist has been able to stop that, and it has made a huge difference in people's quality of life. And we're very thankful that she's willing to help us with that. And then emotional freedom technique is a combination of modern psychology and ancient Chinese acupuncture, where you tap 12 different meridian points on your body to clear energy and help with symptom management. We offer guided meditation to help with relaxation and decreasing anxiety and pain. We also offer homeopathy. The two homeopathic remedies we use the most is one is called NECCC, and that helps with excessive secretions at end of life. And we also have a homeopathic cream that we use to help with pain, and we've had a lot of success with that as well. Are you familiar with homeopathy?
I have not heard of it.
Okay. Well, it's been around for thousands of years, especially like in countries such as India. It's based on like cures like. So a substance that would cause symptoms in a healthy person can be used in a very diluted form to treat those symptoms that a person is having. And the the concentration is very, very diluted. And the belief is that the more diluted the substance is, the more potent it is. So we've seen some wonderful results from this as well. We also had a person who had COPD, and it helped with her breathing. And we also had a client, she was having a lot of anxiety and depression and crying a lot. And we gave her a homeopathic remedy. It was a one-time dose. You just put these little pellets in water and she drank it. And she felt so much better. She was, by the next day, was smiling and feeling just happy. And the facility staff could not believe the change in her. And it was just wonderful that we didn't have to use a medication to try to elevate her mood when we could just use homeopathy. Polarity therapy is another type of energy work that balances a person's body to decrease symptoms. And then Psyche is a little different. It works with a person's subconscious beliefs to change those limiting and self-sabotaging beliefs. And that can help people with such as low self-esteem. And we've seen a lot of people just feel so much better after having a Psyche session. Reiki is a type of energy work as well that's based on the Japanese culture. Reflexology is a type, it's basically kind of a type of massage where you put pressure on different areas of a person's hands and feet that correspond to the organs of a person's body. It promotes relaxation and healing. It stimulates energetic pathways and balances a person's body. Retensioning is a hands-on technique that improves movement and function in people's joints. It assists the person's nervous system to experience an effective joint at rest and really can also bring a lot of pain relief. And then sound healing. There are different types of healing sounds such as sound bowls and rain sticks, and that can, this sound healing can also promote relaxation. It awakens the body, mind, soul of a person and balances their energy. I included some research on here just for the top modalities that we utilize. And I can send this to anybody if they would like. So I have research on healing touch, music therapy, massage therapy, motion code, body code, aromatherapy, and craniosacral therapy. Do you have any questions?
Sherry, will you send those two resources pages and we will send them out with the video?
Yes, absolutely.
And I know when you and I talked, some of this stuff can be done without people having to come there. Can you talk about that a little bit?
Sure, absolutely. So a lot of the energy practices, well, they're based on quantum physics, and so they can be done remotely where our practitioners can just focus on the person they're doing the session on and connect energetically with them. And we have received, just wonderful compliments on the results we're getting. I'm sorry, my throat is very dry. So yes, we have clients in Lincoln, and our emotion code body code practitioner will do sessions on them from Omaha. It's kind of hard to wrap your head around how that works, but it is very effective.
Does that require like the person to be on the phone or
No.
They
No.
can just do it.
Do you see that a lot of hospice providers are moving towards some of these additional practices or means overall, or is this really unique to your organization?
I have seen other hospice companies provide music and massage. I have not seen them provide many of the other modalities that we provide. It is quite expensive to do so.
Yeah.
We are a locally owned company, and so we're able to provide those services because we know how important they are, and we just want to do the right thing and bring as much joy and peace and love and hope to our clients and their families at this time.
So,
A person only passes away once and there's no redos and
yes,
we want everyone to have a good experience.
yeah, I totally agree. So, I mean, if this is helpful during the active process of someone dying, wouldn't this, I mean, obviously there's aspects of this that are helpful just in life. And so I'm just thinking about older adults in general. And if this is something that, you know, there's a way to connect to get people these services that might be in long-term care or receiving some sort of support for something that they're facing.
That is very important, and we have really been thinking about that a lot as well. And so our practitioners can go in, they're mobile, they can go anywhere, they can go into any facility and see anyone or into an elderly person's home. Anyone who can't come to us, we can go to them. Anyone in the community as well.
That's great.
And it's very, I mean, all ages. All of these are very beneficial for people of all ages.
Oh yeah.
Yeah.
This is Kelly. I mean, I was sitting here thinking, I need that, and I need that, and I need
Yes.
that. But really, I mean, you know, Kristen, to kind of tag on to what you said, like, just because I work in the end of life space, we are just seeing like traditional medicine not working for people anymore, especially for those folks that we serve that live with dementia, especially frontal lobe dementia. Like the medicines that we traditionally use, like the lorazepams and, you know, some of those kind of things for anxiety are just actually having the opposite effect. So we have actually more people coming in and less options to be able to, like less pharmaceutical options, I guess, able to help them, you know, with being comfortable at end of life. And that's why this is so intriguing to me, because I just think like, gosh, if we could not have to use, you know, regular pharmaceuticals and be able to just create a better end of life space for people, like that makes sense, alongside, you know, or coupled with the fact that these meds aren't working for a lot of people too. So I think what you guys are doing is very forward thinking, is very patient centered, and I just love it. And I think you guys are, you know, really out there putting the patient first, and I think that's really awesome. So
Well, thank you very much. And you know, everyone's different, just like any medication works differently for every person. You know, we may try something that may not work as well for one person as it did someone else. And so it's nice that we have more tools to try something else to try to help that person as much as we can.
yeah. And there's a lot of people too that just don't want that heavy duty medication. You know, they don't want how it makes them feel, or they've had a bad experience, or they know someone that's had a bad experience. So I think these are all great other options.
I totally agree with you, Kelly. And I mean, we're seeing more and more people that this is the way that they live their life. They live their life through acupuncture and yoga and therapy and all of these things. And why should their older life be any different? Why do we have to change that when this is what someone is used to? So I'm glad that it's becoming more prevalent and more well practiced in this population.
Yes, just over in the last couple of years, we see people asking for massage more than pain medication. You know, it used to be years ago, people asked for more pain medication, and now they're searching out different therapies and different modalities to help them without taking as much medication.
I love it.
Can you all hear me?
Oh yeah, go ahead.
Okay. Wonderful. This is Anna. Agree with all of your comments, in particular, Kirsten, you and Kelly, talking about these different types of modalities. It can apply across the whole age spectrum. And I think of all the significance, the prevalence of behavioral and mental health right now. I'm taking a step back thinking how those individuals could benefit from these type of therapies versus a pharmacological approach. That's what I appreciate about it. And then it was really good learning. I had no idea there's 32 touch points in the head. You know, you mainly think at the temples. Did anybody else think that? It's like, wow, this is really good to know across the spectrum, not just for the elderly, but what can we do to tailor these approaches to each person? Whereas a medication, you can't really tailor a medication. Sure, this is the nurse in me talking. You can tailor it, titrate it, the dosage, but you can't really person center a medication, if that makes sense. Versus this type of therapy, you can make it more person specific. So thank you. This was really good learning.
Well, you're welcome. Thanks for having me.
Jerry, I just have another question because the administrator and nurse in me is going like, okay, so how regulatory compliance, like how do you guys, like does your doctor orders this stuff? You have an order for something, I'm talking about when you're making your creams and your pills that you
There's
drop
an
in the
order for
water.
everything.
Okay. And it shows up like as a non-pharmacological order or like
The treatment order.
Okay.
And then every week we have our whole team meeting where we discuss our clients, our medical directors present, and we talk about the different holistic options that may be helpful for our clients. Our medical director is very much on board with all of these services. She has seen how they worked. She tells me often that she had no idea all of these options were available and how effective they were. But she's very, very supportive.
Awesome. Does anybody else have any other questions? Sherry, when you send your send those resources, will you also just send a little bit of information about your foundation, and we'll put, because I think it's a great thing to be able to support if it can help serve more people.
Wonderful. Thank you.
All right, guys. Well, thanks for coming today. We will send this out on a video, so feel free to share it with other people, encourage other people that didn't get to make it today to watch it, and we'll see you next month for our Clips with the Coalition.
Thank you.
Thank you.
Thank you very much.
Bye, everybody.